Hey guys, we're having some pretty severe thunderstorms and tornado watches out here in the Carolinas. So I came inside to work on my backcountry canine first aid course I've been developing and to put out a little content regarding our dog's vital signs, namely establishing a baseline for our dogs at rest and one for our dogs at work as well, since we are a gun dog kennel and we cater to working dog clients as well. It's important to keep an eye on these vitals and know what's normal so that we can be prepared and understand what's abnormal, especially in the field or in a dangerous situation. So when I talk of dogs' vital signs, I'm speaking namely of their body temperature, their respirations, their pulse, and I also add in capillary refill time or their mucous membranes. Things that we can check to understand whether our dogs are healthy in the moment or not. So again, for me, this time of year, it's springtime, it's transitional, the temperature's warming. Like 3 weeks ago it snowed, and yesterday we had a high in the low 80s, so our dogs are acclimating. They're having a tough time, and they're going to be less inclined to thermoregulate well in this environment as the ambient temperatures outside are shifting rapidly. So understanding temperature is definitely going to help us keep our dogs out of trouble. I want to establish that baseline resting temp. The veterinary medicine community tells us that we can expect a dog to be within the range of 100.5 and 102.5 degrees Fahrenheit at rest, and upwards of 105 degrees Fahrenheit at work. Of course, that 105 is often referred to as a ceiling, and anything above may get you a risk of heat injury, and that of course is true, but you'll notice, and if you've been working with multiple dogs over a career the way I have, you'll see some dogs at work are going to be above 105. You may see 106, 107. I've seen 108 with dogs not in distress and able to thermoregulate their way down relatively quickly. So that's important. We want our dogs, when we see those high temps, rising from 104 to 105, time to quit working, time to stop and start checking those temps and seeing how quickly our dogs get down. We'll get outside later and establish that working baseline in the crate, and we're going to get a temperature with this handy dandy Walgreens digital thermometer. Do your dogs a favor, because we do take temperatures rectally. Get the flex tip. It's like $5 more, but I think it's a kind thing to do for your dog. Also, we want to have a water-soluble lubricant available. Also will make the procedure certainly more comfortable for your dog, and to just keep ourselves from being too unhealthy, we'll don some PPE and keep us from getting too much grossness on us as we do this. So first thing we're going to start with is temp. We'll pull her down and we'll do respirations as well. We'll just talk about getting a quick qualitative analysis of the other vitals. Again, the veterinary medical community is going to tells us that we can expect a pulse from anywhere between 60 and 140 beats per minute. Again, guys, when we're talking about dogs, there's a myriad of sizes between our smaller breeds and our larger breeds, and of course it's going to take more for a larger dog to more energy to pump blood throughout, but they're also dealing with a larger heart, and smaller dogs with a higher metabolism are possibly going to have that more rapid heart rate. So again, I'm not going to sit here, look at my watch, count for 15 seconds, multiply by 4. I'm really looking for that qualitative feel of the pulse. I want to know what strong and bounding pulses feel like. I want to know what the normal pulse feels like. And of course, we talk about weak and rapid or thready as we get into the first aid course. But for now, that normal resting pulse. We're going to know what it feels like, and that strong and bounding pulse when the dog's at work and well hydrated and healthy. We're going to know what that feels like, and hopefully we're not going to see the other ones. But if we do, we'll certainly want to know how to handle that. Respirations, again, for me, qualitative. I just want to know, is my dog panting uncontrollably? I'll show you with Althea what I can do to get an idea of whether or not she's capable of controlling her panting. And then we'll peel her lips back and take a look at her gums and see if they're moist and pink, and if we have a solid capillary refill time. So we'll get her out quickly. Hey, so it's important that we train. We bring our dogs in, we want them to come to us. Althea is just a pup. She's my lab pup. She's only about 7 months of age. She's a little sensitive socially, but not too bad. Enthusiastic worker. And we've been working on presenting herself for me to take these vital signs. So, quick and easy assessment. The first thing you can do is to check for that femoral pulse. We're going to feel along the femur between the muscles. We want to feel with our fingertips. So I can feel down here. I'm going to get that pulse. There we go. And I can feel it. It's nice. It's nice and present. It's strong, healthy pulse, right? And it's not beating rapidly, and it's not hard to find. So I'm going to call that healthy for my rapid assessment. Again, we discussed respirations. Go ahead. So we have Althea here, not panting at all. So I know she's not panting uncontrollably. Otherwise, if she's not in any sort of distress and her mouth is closed, then I know she's not having trouble passing air, especially from any overexertion. So if she was panting, I would bring my hand to the front. If she closed her mouth, I know she can control her panting. Again, if she's panting, I bring my hand in front of her nose and she closes that mouth. I know she's able to control it. So that's important. I'm going to try and get her up nice and close to the camera for you here. And we're going to check capillary refill time on the mucous membranes. So we can see here, her gums, they're pink and moist. She's got normal pigmentation. Some dogs will run a little darker. You can see she's got a little bit of blue up in the gums. Some dogs may even have black gums, but you'll still be able to blanch those out and check for that capillary refill. You see, I press, it turns a little bit white. Again, I press, turns a little white, comes right back to pink. Any capillary refill time of under 1.5 seconds, we know is healthy. Anything slow, we need to be concerned of the dog's health. They're having trouble perfusing that blood throughout the tissues of the body, and that's the number one thing we're concerned with in first aid, is keeping that blood going throughout the body, delivering oxygen and nutrients to the periphery, and keeping the dogs alive at the cellular level. So back here, we've done those. We've checked our pulse in our femoral artery. That femoral artery here, I'm going to pick her up by the rear end for you. Right here in the dog, inside of the leg. Feel in there, feel between those muscles, and nice and relaxed. Good. So, you notice, put her midsection, her abdomen over my leg. I felt that. This is a good controlled position. Get your dogs comfortable in this position, right? Because this is going to help you control for getting that rectal temperature. I'm going to put this, hopefully it doesn't get pulled down for being too dirty or what have you. It's important knowledge. It's important information for you guys out there to know. So again, my dog at rest. One thing to help me control, if my dog's a little over enthusiastic, I'll pin my elbow to my leg here on my knee. I can reach down here and control the tail with my left hand. I'm right-handed, and then I have access to the rectum with my right hand. With my water-soluble lubricant, I've got my digital thermometer. I'm going to just lube the end up really quickly. Make sure it's on. Pick that tail up and get right to work. Guys, if you practice this at home, it's really, really going to help you in the field. Having your dog be comfortable in the situation, understanding how to remain calm through the assessment. And there we go, we have our temperature, 102.4. Oh, there we go, if you can see it. Good, 102.4. Under that 102.5, kind of high normal resting temp. Actually took it earlier today, it was about 101. She may be stressing a little bit because of this. And we've gone out and we've chased a few pigeons around, kind of trying to train them back to the pigeon loft. So I hope that helps everybody understand how to get your resting baseline vitals. Next time we do this, we'll get outside, we'll work out a little bit, we'll start taking those temps, feeling for that brief qualitative analysis on the rest of those vitals, and get that working baseline established as well. I hope everybody is well. Look forward to hearing from you, and till next time.